As you'll know, 9 months ago, on March 16, 2020, we postponed non-urgent scheduled surgeries to ensure our hospitals had the capacity for COVID-19 patients. I asked Michael Marchbank, who is the former CEO of Fraser Health, to provide his guidance and leadership to surgical renewal. And on May 7th, we released our commitment to surgical renewal in BC and began calling patients to reschedule their surgeries. We resumed non-urgent scheduled surgeries on May 18th and have been providing weekly progress updates at our Thursday COVID-19 briefings. We provided our first monthly progress report in July, and this monthly report, our sixth, again chronicles the extraordinary work of everyone in this massive undertaking to change how surgeries are delivered in BC. We said that we would begin calling patients on May 7th to reschedule their surgeries, and we did. On November 22nd, 2020, all health authorities completed their calls to 111,584 patients who were on wait lists before May 7th to ask them if they were ready to reschedule their surgeries. We said that we would start scheduled surgeries on May 18th, and we did. Between May 18th and November 12th, 163,696 patients received their surgeries, including 90% of patients who had their surgery postponed in the first wave of COVID-19. We said that we would begin recruitment and training of new staff to ensure surgery renewal had the nursing, surgical, health science professional, and support staff necessary, and we did. Since April 1st, we have hired 33 surgeons, 32 anesthesiologists, 3 general practice anesthetists, 305 perioperative registered nurses, 38 perioperative licensed practical nurses, 171 post-anesthetic recovery registered nurses, and 173 medical device reprocessing technicians. As well, training has started for 172 surgical specialty nurses, with 86 having completed their program. We will continue with our targeted recruitment and training efforts in the months ahead so that we enhance patient care by continuing to increase nursing, surgical, and support staff. We said that from June 15th to October 15th, we would substantially add capacity by extending daily hours of operation, adding Saturday and Sundays to the schedule, operating new ORs where available, and adding contracted capacity. And we did, with 47 initiatives across all health authorities, adding 7,979 hours of operating room time compared to the same time frame last year. We said we would focus on urgent and long waiting surgeries, and we did, by performing 996 more urgent scheduled surgeries and 6,299 more surgeries for patients waiting longer than 2 times their target wait. We said that we would reduce the summer slowdown period, and we did, achieving a 37% reduction. We said that we would get patients the surgeries they need, and we are doing exactly that. By calling patients and performing more surgeries, we're reducing the time patients wait for surgeries. The total wait list has been reduced by 6% since March 31st, 2020, and by 12% since it peaked at 100,297 patients on May 28th. These are all remarkable achievements at the 6-month mark. Some of them are truly extraordinary, and they make a clear point. Surgical renewal isn't just a hope. It's not just a dream. It's a commitment to patients that's being delivered right here in BC. And with that, I'll again welcome Michael Marchbank, who was here when we presented our first monthly update last summer, and who will speak in further detail about key aspects of our progress and what these milestones mean for continued achievement ahead. Michael.
Thank you, Minister Dix. I appreciate the opportunity to be here today to highlight all that has been accomplished in the short time and talk about our work ahead. I want to reiterate, the first slide please, what you'll see these points in the at a glance. The next slide please. At a glance. That I saw up to and including my time as a health authority CEO. However, it would not be possible without the hard work and dedication of all our frontline staff and all of the leadership within the healthcare system. Everyone has come together to deliver on our commitment to meet patient needs, and all of us thank them for that. I'll now speak to some of the significance of some of the points that Minister Dix has made. The next slide, please. Health authorities have made an impressive 111,584 calls to patients. But what we've learned from this is that patients have appreciated those calls. It added a kind and reassuring personal dimension during an uncertain period. We also learned that in some cases, patients no longer wanted surgery, or had already had their surgery completed, or were not in fact even on the wait list because of errors. What resulted in this was just over 8,000 patients being removed from our wait lists. This is an important advance for the system, because we are now working with a more accurate wait list, and we can better devote our attention and resources to these patients. Moreover, we're continuing to call patients waiting for surgery on a quarterly basis so that we can sustain this personal contact and this accuracy. Next slide, please. Minister Dix said our focus on performing more surgeries and adding operating room time is producing welcome results. It's important that we remember that it was mid-June before our surgical capacity returned to the level it was before COVID. Progress continues to be made month over month and week over week. Across the 4 reports being released today, we have performed an additional 1,860 total surgeries, which you can see on this slide. If you include the 904 additional surgeries we did in our second progress report, we have now done 2,764 more surgeries since we ramped up fully in June. This is an excellent accomplishment in such a short time. We can see that the progress continues, as I've said, month over month, but week over week, as the Minister's weekly progress reports since November show the performance is holding steady and even improving. Next slide, please. Under surgical renewal, the immediate focus was shifted to addressing postponed, urgent, and long waiting cases. I know from personal experience and discussions with surgical patients that waiting is perhaps the most difficult thing, and especially if you're waiting for an urgent surgery. And I'm pleased that we've been able to invest in areas to prioritize the patients that need to be prioritized, our long-waiting patients and our urgent patients. To meet these priorities, we have shifted the allocation of operating room hours. Neuro, ENT, ear, nose, and throat, plastic and thoracic surgeries continue to see increases. Orthopedic and dental surgeries also are seeing additional hours. Next slide, please. In making a surgical renewal commitment, we identified several strategies to add the capacity to increase the surgeries being performed. Those included extending surgical days, adding surgeries on weekends, opening new operating rooms, and new operating rooms that weren't being used, reducing slowdown periods, and adding contracted capacity. It was a significant shift, and the response by the health authorities to achieve it has been dramatic. So far, they have implemented 47 initiatives to add capacity and deliver more surgeries to our patients. What we have seen so far includes extending days in 11 operating rooms, adding weekends in 4 operating rooms, opening 23 new or unused operating rooms, maximizing our capacity at our non-contracted sites, and achieving a 37% reduction in summer slowdowns. The health authorities are continuing to add new initiatives throughout the winter and spring to add to the progress that they've made in the first 6 months. What this means is that from April 1st this year to March 31st of 2022, health authorities will add 24% capacity increases over the base year of 2019-20. And what this means for patients and their families is about 99,000 more operating room hours, and this means more surgeries for those who need it. Next slide, please. Next slide. This achievement requires a massive investment in hiring and training nursing, surgical, and support staff. Minister Dix reported our progress so far, and it is remarkable. Each health authority is driving and achieving this progress. Fraser Health has made 70 hires, Interior Health 264, Island Health 146, Northern Health 64, PHSA 31, and Vancouver Coastal has made 180 hires. These hires, and we are continuing to make them all the time, ensure that we have the staff required as we add new capacity. But there's more to it than that. These hires will ensure the sustainability of the surgical renewal commitment going forward, as well as reducing overtime burdens and staff burnout. These are important and critical issues to the system, and on one front we have seen some encouraging news. If we look at staff in the OR system during the most recent quarter, which ended September the 30th, we have seen a slight reduction in overtime hours. So they are stabilized, and they are and we are not seeing a significant increase in overtime hours. COVID-19 has challenged all of us to do things differently, to learn and to adapt so that we can continue to care for our patients. This is the foundation on which we have built our surgical renewal commitment. It is a solid foundation, and it is holding. By beginning to make the kind of dramatic progress we have made in these first 6 months, we will be able to continue our success in getting the patients the surgeries that they need. Thank you.